Here's the measurement between the CJ and the bone level, and same thing for the lateral incisor. Now, even if you're seeing that the bone level is at the right height, you may be tempted just to replace the tissue back without doing anything with the bone, and that would probably be a mistake because your tissue will regenerate because you didn't address the horizontal dimension of bone, and that's what we call festooning. It's extremely critical. We go over this in the crown lengthening course. If you fail to do that, you may have a whole treatment relapse and basically a failure. So this is after the festooning. You see this patient's bone looks now completely different. It looks more convex around the roots, more concave in between the roots, and that's the pattern of festooning that is more anatomical, that allows the soft tissue to heal properly. The way it's done is with a diamond burr, basically first creating our channels between the roots. Be careful not to damage the root surfaces, and then just blending everything in, finalizing or finishing off with hand instruments. And that at the end of this process, you'd like to make sure that you have good vertical height of bone and good bone recontouring, meaning the horizontal dimension of bone is properly contoured, that is more anatomical. And last but not least, we need to address the frenum, because if we don't resect the frenum, what's going to happen, this frenum is going to pull on our flap throughout the healing period, and that could compromise the results. So the tricky part here is when you create a frenectomy, you will technically perforate the flap. So you need to be extremely cautious. So what I do, I hold the flap with cotton pliers, carefully resect the frenum, hold my blade almost parallel to the tissue. Again, it's a little bit tricky. It's certainly doable. You need to practice a couple of times. So once you finish your frenectomy, the strategy of suturing is to suture the flap first with simple interrupted sutures. And once the flap is stable, then you can go ahead and suture your frenum. I also used scissors and loosened up the mucosa a little bit below so I can approximate the tissue and suture it properly. So this is at the end of the procedure. And here's the healing about 3 weeks later, and the implants on the upper right were already uncovered. So we are now in the process of creating proper soft tissue architecture around the implant, which is going to be extremely challenging, and the prosthodontist and the surgeon involved in this case were well aware of these challenges prior to starting. So it'll be really exciting to see how this case is going to turn out. But in regards to what you saw in this video, you saw the sequence of aesthetic crown lengthening and how we lengthened the central and the lateral incisor on the upper right to create better symmetry, better balance, to maybe offset the deficiency on the left. Again, it's going to be challenging. It's going to be interesting and fascinating to see how we can overcome this challenge and give this patient a great result. I hope you enjoyed this video. I hope this was valuable in talking about aesthetic crown lengthening and some of the considerations in the more difficult cases. If you didn't sign up yet for the crown lengthening course, go to crownlengtheningsurgery.com, sign up for the waiting list to be the first one to know about the course. If you're watching this video a little bit later on, still go to the same link and you'll be directed to the course. You can always join. I look forward to seeing you in the next videos. This is Ziv Simon from Surgical Master.